Hi, I'm Carolina Pataki, and I want to provide you with a little bit of information around mental health today because there is so much misleading information out there. So first of all, I want to talk a little bit about the differences of facilitators and practitioners. So we have on one end we have psychiatrists, which are doctors and they prescribe medicine. And then we have social workers, marriage and family therapists, along with mental health counselors, where this is where you could actually go and get some talk therapy along with different modalities that they might practice. So when you're thinking about therapy, which therapy really is about self-care, you're exploring your beliefs, so the way that the emotional cycle works, because it's basically you have the belief system, so the thoughts, and that is connected to your emotions. A lot of times we're not aware of our emotions. If we become aware of our emotions, these are feelings. This is connected to a behavior. When we're not aware of our emotions, we're certainly not aware of our behavior. And then this is connected to an outcome. And so a lot of times when we're really frustrated in our life, unhappy, unfulfilled, we need to trace back to our beliefs to really explore our belief system. So there's different modalities to get to those belief systems. So I would highly recommend that when you're looking for a therapist, and if you're interested in looking for a therapist, because there is still so much stigma around it, when it really is more about exploring your belief system so you can really understand your emotions and your feelings so you could change your behavior then. But so basically, when you're looking for a therapist, you want to be able to make sure that you could talk to the therapist for maybe 10 to 20 minutes first and ask a little bit about their modality, along with exploring a little bit and asking them, about what you might be noticing in your life that you're not happy with or that you're not fulfilled with. That way you could actually get a little bit of a sense of if you connect with that therapist or not, because that's also another important element of therapy. You want to make sure that you're connecting with the therapist that you're working with. Sometimes you might want to try out one session to actually find out if you connect with that therapist, but at least get those 10 to 20 minutes with them. So this is one of the things that one of the reasons why mental health is actually so important. It's not just about the stigma behind it, which has nothing to do with actually the stigma behind it, that it's just for crazy people or for people that have some kind of mental illness or some kind of chemical imbalance. Mental health goes a lot further than that. It really is about self-care, understanding yourself a lot better, so you could really start creating the life that you ultimately want. And the only way to actually do that is to really get to the bottom of your beliefs and your emotions so you can change that behavior and that outcome at the end of the day. Thank you so much.